I've been a nurse for a long time, and new graduate nurses often struggle with taking more than one patient, especially when they start practice and things are really busy and it's just a little bit overwhelming for them and they get discouraged. So doing the multi-patient sim gives them the experience to do that here in a safe environment where we can kind of troubleshoot through some things and talk about some things and help them see prioritization, delegation, the importance of that as they're trying to care for multiple patients. At a wide variety of patients, we do have somebody who goes through alcohol withdrawal pretty severely and needs to be medicated for that. We have a diabetic patient who needs dressing changes, insulin. We have someone else that needs IV antibiotics and discharge instructions and has some questions about insurance coverage. We deal with a couple of HIPAA situations where they have to be able to recognize that they cannot share information.
It sounds like she would prefer you stay out here, okay?
Well, then tell me when I can come back.
Okay, you stand out here. I'll chat with her a minute, okay?
I'll wait right here.
We have a Spanish-speaking woman who is a victim of sex trafficking and human trafficking, and that we are trying to kind of get the students to do this, as well as a pregnant patient who ends up having complications and needing an emergency cesarean section.
For each pair of students, there's 3 patients. So you can imagine if we have 9 pairs of students or 9 teams, then that would be around 27 patients. So it can be very heavy trying to get standardized patients to come in and portray these different roles, as well as staffing for faculty, staffing sim center as well, staffing needs. Those are just a lot of setup logistical pieces that make it complicated to run.
So this morning we had a case where we needed to put some bruising and some grab marks and some cigarette burns on the chest. And what our goal is to have standardized patients do some of their own makeup. So one person is not holding that in the schedule and trying to do all of that all at once. At first you get a look like, I have to do what? And how do I do that? And they're looking, and I don't know if I can make it look as good as that, but the more that they do it, the more that they apply, the better they become, and they do just a fine job.
There's a lot of setup and a lot of parts with each of the cases. So whether it's IV solutions or medications, there's a lot of equipment that we need as well, and it has to be staged.
So we really started collecting all of our supplies, putting them in a single bin that's locked and not opened unless it's for a multi-patient simulation event. So these bins have their IV supplies, their medications, any IV fluids. They'll have their ID bands. We collect all that at one spot, and then when it's time to set up, we just lay it in that room and it's good to go for any member of the team is able to come in, follow a setup sheet that has pictures in it, as well as descriptions of where to put things.
Students have the opportunity to experience the multi-patient simulation at the beginning and then at the end of that final semester of their nursing school. And it's been really special for not only students and staff, but standardized patients to be able to see the growth in students from the beginning to the end, to see the confidence and the preparation that they put into taking care of them. And I think that has helped all of us just have a much smoother experience, knowing to be able to see the outcomes, right? To see the growth in students has made an impact on how we move things forward.